Let's talk about the cast in urine. Very important. Just by its looking or knowing which cast or what, we can right away tell which pathology are we talking about. So normally for this, we have to know the normal. What is the normal? Normally in the urine analysis would show less than 5 RBCs. Proteins would show if they're greater than 300 per 24 hours excretion. That will be seen in the urine analysis. And now that urine analysis can tell difference between what is an RBC, what is a hemoglobin, or what is myoglobin. So let's now read the cast in urine. It is the presence of cast indicates that hematuria, pyuria is of glomerular or renal tubular origin. Okay, either glomerular or the renal tubular origin. Bladder cancer or the kidney stones lead to hematuria and no cast. So if there is a bladder cancer or kidney stones, they can cause blood in urine but no cast. Okay, acute cystitis is going to give us pyuria but no cast. All cast contains a metric composed primarily of TAM horsefall mucoprotein, which is uromodulin, secreted by renal tubular cells to prevent UTIs. Okay, so let's talk about now RBC casts. Look in picture A, RBC cast. RBC casts are seen in glomerulonephritis. Remember, we just said that the cast will tell us that either it's the glomerular disease or renal tubular disease, because we can't form cast in the bladder or in case of kidney stones. Okay, so RBC casts are due to the fact that we have glomerulonephritis, hypertensive emergencies. And RBC cast, we will see RBCs in the cast, right? Because it's RBC cast. WBC, we'll see WBCs in the cast. It will be seen in tubulo-interstitial inflammation, acute pyelonephritis, and transplant rejection. Granular casts, they are acute tubular, seen in ATN, acute tubular necrosis, can be muddy brown in appearance. Okay, so what is a granular cast? Well, these granular cast, they are sloughed tubular epithelial cells with pigmented granules. So there are the tubular cells that have been sloughed off due to necrosis. And when you slough off those tubular epithelial cells, they are shown as muddy brown. Looking at picture C, muddy brown appearance of these casts. Moving on, we have the fatty cast, oval fat bodies. Looking at the oval fat bodies, they are seen in nephrotic syndrome associated with Maltese cross sign. Okay, Maltese cross sign and the oval fat bodies. What are oval fatty? What do we have? We basically have lipid content, lipid droplets. So maybe think about this as a droplet, lipid droplet. Then you have the Vaxicast. Vaxicasts are seen in end-stage renal disease, chronic kidney disease. They are degenerative hyaline casts. So what is a hyaline cast? Hyaline casts are non-specific, can be normal finding with dehydration, exercise, or diuretic therapy. Hyaline cast is the one they are talking about. They are the TAM horse fall mucoprotein or just protein. TAM horsefall mucoprotein, they are normal cast known as hyaline casts. And if you have a degeneration of these hyaline casts, that is seen in ES, RDs, and CKDs. Okay. Nomenclature of glomerular disorders. We have focal meaning less than 50% of the glomeruli. We have diffuse, meaning greater than 50% of the glomeruli. Proliferative, meaning hypercellular glomeruli. Membranous, meaning thickening of the GBM, which is the glomerular base membrane. Primary glomerular disease, meaning primary disease of the kidney, specifically impacting the glomeruli. Primary glomerular disease. Secondary glomerular disease, systemic disease or disease of another organ, systemic that impacts the glomeruli. Secondary glomerular disease, like SLE, diabetic nephropathy, and the others are right there. And one more thing, when we talked about this TAM-TOF proteins, so normally we have an excretion of a protein at 30 to 50 milligram per 24 hours. That is normal protein excretion. And they are known as TAM horsefall proteins because they are the sloughing off of those tubular cells. Okay. In multiple myeloma, you will see Bence-Jones proteins, right? And they will be seen as glossy, waxy, eosinophilic casts. Okay, so these are all about the cast and the nomenclature.